Welcome back to Wave Listens Live. Joining me now is Dr. Reagan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, it's always a pleasure to have you on the show.
Thanks for having me.
Yeah, and you always bring the models, which I always love. Of course, we're talking about teeth models. I'm very much a visual learner. Yes. I've told you that plenty of times before. But I want to introduce everyone for people who maybe haven't seen you on here before. Remind everybody what Freedom Mini Dental Implants is, what you do, and who you help.
Yeah, certainly. So what I specialize in and kind of have focused my practice on is mini dental implants. And everybody's like, what's the difference? What's a mini implant? So basically the mini part just means it's a smaller diameter implant. It's also a one-piece implant. Not to get too technical, but the abutment, the part that sticks out of your gum, is built in, so it makes it just as strong as a standard size diameter implant. But the beauty of the mini implant is it's a lot less invasive, it's less healing. So a lot of people that were told maybe they weren't a candidate for regular implants or didn't have enough bone or needed sinus lifts or bone grafts, a lot of times I can help them out and do the mini dental implants. One of my favorite things to do is somebody that's been struggling with dentures for 5-10 years, didn't think they had any options, thought they were going to be stuck with these regular dentures forever, and I'm able to tell them they're a candidate for the mini dental implant and get rid of denture glue or get rid of the dentures completely.
And I think this here on the table is a good representation of that. You see the different size and the holes that end up going into your bones, and I think that's a really good representation 100%.
Of that. So this is kind of a model showing the difference. So the big hole that you can see pretty well, that is not the hole that I have to make when we place an implant. I don't have to make an incision. I'm making this smaller hole, which is difficult to see sometimes, but which also shows though that I don't have to have as much bone to place an implant, which is why I did it on a lady actually on Thursday morning. She had been struggling with a lower denture forever, had been told she didn't have enough bone, but she had enough bone for me to be able to place a mini dental implant. I placed 5 mini implants on her that day, and she left with her denture snapped in that day. So no more glue, no more floppy denture. But this model just really shows how I just have a small amount of bone, and it's a lot less invasive. I don't have to make an incision, no stitches. When you leave, you're not bleeding. It's a very, very less invasive way of placing implants.
And you've got so many different ways that you can implement these mini implants as well, whether it's individual teeth or just a certain row of teeth. And you've got some examples here. Explain to me the difference between each of those.
Yeah, certainly. So I will start probably with the most common thing I do. And like I said, probably one of my favorite things is what we call a snap-in denture. So many people think they're going to get dentures, all their teeth, and it's going to solve all their problems. But then they just have another problem of having to wear dentures and keep them in. So this is what we call the snap-in denture. So these are the mini implants. This is, what it would look like after I place the implants. When I place these, I'm just numbing local anesthetic. A lot of people know it as Novocaine. I do not have to put you to sleep. We're not doing sedation because it's a lot less invasive. Like I said, no incisions, no stitches. Place these implants. And then the same day I put the implants in, I will put the attachments inside your denture. And then that day, you leave now with the denture snapped on to the implants. So you don't have to use gobs of denture glue. If you have a family member struggling with it, they probably go to dinner and then excuse themselves to go reapply their glue. So you get rid of the glue and it stabilizes your denture. So it stays in and you get to eat better. You'll wear the denture 24/7. You just have to snap it out once a day, rinse and clean everything, and then snap it right back in. This is one of my favorite things to do for people that are struggling with dentures.
And then we've got a couple examples and pictures of people, some before and afters, that are using that exact technique.
Yes. So this was Jeff. He came in with existing teeth that he knew were failing, and he needed all his teeth removed. So he went through the healing process with regular dentures, and then just a couple months later we were able to place his implants, and now he has snap-in dentures, so he does not have to put glue in every day. He can eat steak, he can eat salads, all those things that people with regular dentures, miss eating. So yeah, that's a fantastic example of Jeff, improving his smile and getting him in a better situation. She was in a very similar situation. You can kind of see her teeth were breaking and failing, and we were able to give her snap-in dentures as well. So she wears those 24/7. She just snaps them out once a day, rinse and cleans them, and she's able to eat again and have confidence in her smile again. You know, she's not embarrassed or ashamed about her smile and has that confidence.
And I think it goes without saying, and I know you know this, but it just looks so natural.
Yes.
Like in her mouth, for example, you would have no clue that it's something like that.
I get that question all the time. If people have to get dentures, they come in, they're like, I don't want horse teeth. I see people with awful dentures. You know, I've been doing this for many years. I've placed probably, I think actually my daughter asked me today, and I calculated over 6,000 implants, hundreds of dentures, and so we try to make it look as natural. And you're involved in that process. We look at color and shade together. We look at pictures. Our patients are always involved in the process.
Yeah, and I think that's important too. It's not just, okay, getting teeth in there and, well, okay, well, the teeth are in there, that's enough. But you want to make it look like they belong. And that sometimes the thing that looks like it belongs the best isn't just white teeth. It's something that looks a little more like they did.
100%. It is not cookie cutter. And we want it to fit them and their personality. You're right. Some people want that big, bright, white smile, but some people want something more natural as well.
And we've only got like a minute left here, but I know you got a couple different ways. Like that might be a good thing for people who need a lot, but you've also got this one right here.
Yeah, so we
individual
do
teeth, maybe some physical trauma you've had.
Yeah, if you're just missing one tooth or just, you know, 2 or 3 teeth, we do that as well. And there's also another way we can get rid of the denture completely, where you have permanent teeth cemented on, so you don't have to take anything in and out. So there's a lot of different ways I can use these mini implants. It's not just the snap-in dentures. And the consultation is free, so please go to freedomimplants.com. It's a free consultation. It includes the 3D x-ray to make sure you're a candidate for the implants.
Well, Dr. Ackerman, always a pleasure to have you on the show.
Thank you.
Yep, so make sure you're visiting that website if that's something that works for you. That's all we've got today, though, here on Listens Live. No worries. We'll be back on Monday. See you then.